Welcome back. December 1st is World AIDS Day, a day to emphasize the urgency of our collective commitment to ending the HIV epidemic and to honor and remember those we have lost to HIV. This year's theme, World AIDS Day 35, Remember and Commit, commemorates the 35th anniversary of this important day and serves as an opportunity to reflect on progress while recognizing remaining challenges. Earlier this year, Namibia received an award from the U.S. President's Emergency Plan for AIDS Relief, PEPFAR, in recognition for its remarkable progress towards reaching the UNAIDS 95-95-95 targets and progress towards ending the spread of HIV/AIDS by 2030. To share more on Namibia's progress in reducing HIV and AIDS incidences is Dr. Brian Baker, the Head Country Director for the Center of Disease Control and Prevention. Dr. Baker, good evening and welcome to the show.
Good evening. Thank you so much for having me.
Dr. Baker, please provide specific data on Namibia's progress in reducing new HIV infections and AIDS-related deaths in recent years.
Sure. As you mentioned, tomorrow is World AIDS Day, and it's really a cause for celebration in Namibia. Namibia's achievements in fighting the HIV epidemic have been absolutely incredible and serves as a model for the world. 20 years ago, there was no available treatment for HIV, and hospitals in Namibia were overwhelmed, and thousands of children were born each year with HIV. With the support of the United States government over the past 2 decades, Namibia was able to introduce universal testing and treatment for HIV, allowing people to live long and healthy lives. And as a result of this partnership, today, new HIV infections have reduced by 80%. And the estimated number of people who die from HIV each year has been reduced by almost 70%. Really incredible and remarkable accomplishments.
Namibia received an award, Dr. Baker, from PEPFAR in recognition of its remarkable progress towards reaching the UNAIDS 95-95 targets and progress towards ending the spread of HIV/AIDS by 2030. So how would you say Namibia's response to HIV/AIDS has evolved as well?
Thank you. As you noted, the award from PEPFAR was in recognition of 20 years of achievement against HIV and for really being one of the first high-burden countries in the world to approach control of the HIV epidemic. And as you noted, the response has evolved greatly over the years. At the start, it was a national emergency. The Namibian government and civil society and communities had to muster a massive effort to test and treat everyone with HIV in the country. It was a decades-long progress, and we are now seeing the incredible benefits. Now, today, the first priority is avoiding backsliding and making sure that the 200,000 plus people living with HIV and on treatment in Namibia are remaining on treatment for the rest of their lives and remaining healthy. At the same time, an additional focus is now supporting those remaining underserved groups, including children, pregnant and breastfeeding women, men, and other key and vulnerable populations, to make sure that all of them have access to the same services if they're diagnosed and treated as well.
Talk to us about these strategies Namibia has implemented to ensure widespread awareness and education on HIV and AIDS. Yes, please talk to us about that.
Sure. As you know, raising awareness and education are essential to any health initiative, and that has certainly been true for HIV from the start. In Namibia, that's included all forms of media, from radio to print newspapers, and in more recent years, social media. HIV education is routinely included in school curricula and routinely introduced to adolescents and teenagers. But I think most importantly, educational efforts involve engaging communities themselves and normalizing talking about HIV. A big focus in communities working with local leaders is working towards reducing stigma and discrimination and making HIV a part of our everyday conversation so that everyone knows that people living with HIV can live a long and healthy life if they take their medicine correctly and consistently.
And what role has government played in promoting testing and treatment? And what percentage of people living with HIV in Namibia are aware of their status and accessing treatment?
The Namibian government has led the response from the start. The support from the United States government and the United States Centers for Disease Control and Prevention and other stakeholders has been critical, but it's really the Ministry of Health and Social Services that has led the effort at all levels. As a result of 2 decades of tireless, dedicated leadership by the ministry, as well as communities themselves, today more than 95% of people living with HIV in Namibia are now know their status. They know if they're HIV positive. 97% of those who know their status are on treatment, and 94% of those on treatment have the virus suppressed. All these factors combined tell us that Namibia is well on its way to eliminating HIV as a public health threat by 2030.
Dr. Baker, can you highlight successful community-based initiatives or partnerships that have played a significant role in Namibia's HIV/AIDS response?
Sure. There are numerous examples of successful community-led programs in Namibia, including peer education support groups, community health worker initiatives, and campaigns that focus on local needs and priorities. And these efforts have prevented new infections and saved lives by increasing access to services. One important example I want to share with you is something called teen clubs. These are led by the Ministry of Health and supported by the United States government. And these clubs are established for young people living with HIV. As you know, being a teenager can be difficult to begin with, and being a teenager with HIV can feel like an enormous burden. So the teen clubs provide a platform of support, empowerment, camaraderie, and fun for young people living with HIV. So the needs of young people are different than those of older populations, of adults, and peer support models like this allow communities to lead.
Are there any specific regions or communities, Dr. Baker, within Namibia that have shown notable progress or face unique challenges in the battle against HIV and AIDS?
At this point, I've visited 12 out of the 14 regions in Namibia, and I can sincerely say that each region and communities within those regions are distinct and have distinct needs. The challenges in Zambezi are quite different from Kunene or Karas. And ROUNDUP, where I am right now for World AIDS Day in Marienthal tomorrow, has its own local challenges. So I think that what we do know is that to address the incredible diversity of Namibia, it's important to empower communities to find local solutions. HIV requires local leaders, and those local leaders to engage their communities to push us forward towards the future and ending HIV as a public health threat.
As you just mentioned, you're in ROUNDUP region to commemorate World AIDS Day, which is tomorrow. What can the public expect?
So it will be really a large effort led by key stakeholders, obviously the government of Namibia and the Ministry of Health and Social Services, many of the community organizations, including networks of people living with HIV, local businesses and other organizations that are devoted to improving the health of their communities. I think the theme, one of the big themes this year, is really making sure that the communities are leading. Really to sustain all the incredible gains of the past 2 decades requires the average Namibian to take charge for their own health, those of their families, those of their friends, and their larger communities. So I think you'll see a really great turnout of a diverse amount of people from across Namibia and across the region.
Dr. Brian Baker, we appreciate your time. Thank you so much for joining us here on the Daily Roundup.
My pleasure. Thank you so much for having me.
That was Dr. Brian Baker from the CDC speaking to us on World AIDS Day. Of course, the progress and wins that Namibia has had in the fight against this in relation to our goal for 2030. He is currently in the ROUNDUP region in Marienthal, where the commemoration of World AIDS Day will be taking place. And yes, I don't want to sound cliche, but it is important to get tested and to know your status. We'll be right back after the short break. Stay with us.